Perceptions of quality can differ as the concept of quality can be described in a variety of ways. The Clinical and Laboratory Standards Institute, or CLSI, an organization that develops consensus standards for laboratory practice, defines quality as the degree to which a set of inherent characteristics fulfills requirements. You can also consider quality in healthcare in two broad categories. Scientific or technical aspects of quality care entail how well clinical procedures are carried out. Non-technical or interpersonal are aspects of quality care that involve how well the personal needs of the patient are met. Another broad way to describe quality in healthcare uses three major concepts. Efficacy. The healthcare services provided have a positive impact on the patient's health, that is, the patient improves or gets well. Appropriateness. Procedures performed on the patient were the correct ones for that particular condition or illness. Caring functions. Services provided to the patient are available, timely, effective, safe, efficient, respectful, and sensitive to the patient's needs. The quality of phlebotomy services focuses not only on meeting a minimum standard, but also on constantly improving the services that are provided to stakeholders, consumers, or customers. Unfortunately, phlebotomists can have a negative impact on quality. For example, misidentification of a patient could result in an erroneous cross-match and blood transfusion, which could be fatal to a patient. Inappropriate cleansing techniques or hand washing could transmit infections. Poor venipuncture techniques could result in nerve damage or severe pain. Lengthy waiting times, rude behavior, or messy work sites can contribute to an overall feeling of patient dissatisfaction. Numerous resources are available for you to improve your practices. Therefore, it is imperative that you assume some responsibility in continuous quality improvement, or CQI. Quality improvement, or QI, is the concept of meeting and exceeding customer expectations by resolving immediate problems and finding opportunities for improvement where problems do not currently exist. Quality improvement efforts for phlebotomy services usually focus on pre-examination issues. Phlebotomy procedures that are commonly monitored are patient identification, isolation techniques, precautions, venipuncture or skin puncture procedures, time required to complete venipuncture, percentage of successful blood collection attempts on the first puncture, percentage of second attempts at collection, appropriate use of collection devices, appropriate transportation and handling, completion of forms, documents, etc., specimen processing, storage of specimens, reporting results, and follow-up procedures when needed. Outcomes are what has been accomplished for the patient. Poor patient outcomes have been described as the 5 Ds: death, disease, disability, discomfort, dissatisfaction. Outcomes assessments often rely on information in the patient's medical record, laboratory reports, or what is self-reported. Outcome-related issues that are commonly monitored are misidentification of specimens, hematoma formation, nosocomial infection rates, contaminated or hemolyzed specimens, excessive blood sampling, repeat specimens, response time, volume of daily blood loss per patient, number of patients who faint, turnaround time for specimen collection, turnaround time for lab test results, correct timing of therapeutic drug monitoring, and patient satisfaction questionnaire results. Customer satisfaction is another important quality improvement concept. Customer satisfaction is a simple measure of how happy are the stakeholders with the services provided. Patient waiting time, the frequency and the types of patient complaints, and the frequency and types of physician or nurse complaints are all areas that you should be concerned with.